with Sweden Ghana Medical Center. And now there is hope for the cancer patient. You don't have to worry, don't give up now. As long as you are a Ghanaian teacher or relative, treatment is free. You don't have to worry, just keep hope alive. 'Cause with Sweden Ghana Medical Center and NAT, God will heal.
As a teacher, how are you preparing tomorrow?
It can be prostate, cervical, breast, endometrial, head and neck, colorectal, or any other cancer. They have no place here. Why? Because SGMC Cancer Center treats all solid tumors no matter the stage of the disease. We use advanced technology like radiotherapy, brachytherapy, and chemotherapy for our treatment. Locate us behind Lakeside Estate, Community 8, Katamanso, or call us today on 0201 409 403 or 0262 253-328 for inquiries and booking, and your cancer burden will be a thing of the past. NAT, Narrate, ECG staff, as well as their spouses and children below 18 years do not have to pay to receive treatment at SGMC. SGMC Cancer Center, taking away the burden of cancer.
Like and follow us on Facebook, Ghana National Association of Teachers -NAT. Follow us on Instagram, NAT_HQ. Subscribe and watch our videos on YouTube, Ghana Teachers TV. Follow us on X, Twitter at NAT Official. Read more about NAT on www.ghanateachers.com or email us through info@ghanateachers.com.
Cancer is something that you will not wish for your enemy, let alone wishing to benefit from it. But like a good family, we have something we contribute 5 cedi together for the NAT Cancer Fund. And your money, my money, is used to treat a colleague. Several times we go, people will tell us that, where are the people? Sickness is something we call, like, we respect the privacy of it. But of late, those who want to volunteer, we let them come on screen. And those of you who watch TV, today the NAT Hour, you see it being screened live. Cancer is one of the diseases people fear it because it doesn't present any symptom. It doesn't. The time you see the symptoms, but then it is normally sometimes too late. The time you feel the pain, you feel the lump or some of the symptoms being exhibited, sometimes it is too late. So we are saying that the fact that you don't feel any symptom doesn't mean you don't go for checkup. So please go for regular checkup.
My name is Michael Jojo Akwan from Takrade, basically Shema, Western region, yes. But my mom was teaching at Ola College of Education. So we were staying at Cape Coast until her demise, then we went back to Takrade. I think she was a member of NAT. She was also, I think, the district secretary, something like that. Yes, so she was already aware of the cancer program that NAT offered. So immediately she was not feeling well. She went to the hospital. She was diagnosed. Then she started the treatment with the SGMC. And it was really helpful. It was really helpful. Even as at that time, I had not even entered the Ghana Education Service. But when I saw the assistance they were giving her whenever she went there, the kind of report she brought was very nice. Yes, you know, forgive me, but when you go to certain hospitals, you come back very depressed. But this one, she goes and she comes back happy, and I saw that everything was going on fine.
You only need your pay slip and a national ID card to confirm that this pay slip is mine. That is all. The team will take you through. The only confirmation is your ID card and then your pay slip to show that you are a NAT member, and they will begin treatment because this is your health issue. So if we put in place bureaucratic measures that I must write a letter and you happen to come to the region and I'm not there, are you going, your treatment is going to be suspended because I am not there? No. So we have made it simple. If you are diagnosed, God forbid, but if anybody is diagnosed of cancer, you only need to walk to the center with your pay slip and any national ID card confirming that I am the owner of this pay slip, and treatment will commence. Please, it covers you and your spouse and any child. So it is nuclear. It is not extended. Others came and we said, my sister. So you cannot give it to your sister. If it is your husband, fine. If it is your wife, fine. If it is your child, fine. But your mother, your father, it doesn't apply to external family. That is for now. But if in the future we are able to manage it and cost comes down and we have more money, then we can rope in more of our extended family. But we shouldn't get to that. And that is why we are here to share light on what we are doing, what you stand to benefit, and what you should also do as a man. That at least for prostate, you can do that every 2 years. Prostate, you can go for the checkup every 2 years. For the ladies, cervical, breast, you need to screen regularly. Now, cancer is even developing in other areas that traditionally were not. You have people now developing cancer of the brain, others getting throat, which is coming out, others getting even the toe. So we need at least to do a total checkup of our system so that if it is not there, you are okay. You live a comfortable life.
Whenever I spoke to people that my mom suffered cancer, they are amazed because they have idea about the financial stress that sickness brings. Yes, but they don't know that we were cushioned by NAT. I have knowledge on it and I'm going to make a move towards it. But I know that I know that program that NAT has brought on board concerning their cancer patients to help them with their treatment.
We were taking the cost. We refer them to the center. So they consulted us, contacted us. And then the National Council took a decision. Why don't we purchase that facility? So NAT has acquired that facility. And at the moment, they are plans are far advanced to put up a hostel. It's completed. Okay, so the last time I was there. So now the hostel is complete. The location is that Nanakrum, that's around Asalboche, Adenta side. Asalboche, Adenta. But you see, anybody going there we give you the call, the center. They send you the location, and there are even staffs ready to take you to the center. Okay, so like I was saying, we acquired the place. One of the challenges was those seeking the treatment had an excellent ward to relax and get the treatment, but those taking care of them didn't have accommodation. And at the time the decision was taken, but I'm just told that the accommodation has been completed. That is to cater for you taking care of somebody receiving treatment. You can at least be accommodated within. This effort we are making shouldn't go in vain. We are saying it shouldn't go in vain because we encourage you to do the screening. There's no point if it is detected at the last hour that we cannot treat you. What is the point? Are you getting it? So we want you to live to give a story and to tell people how good your mother union is. So like he was saying, if you have questions, clarifications you are looking for, you can ask so that we give you all the explanation there is to it.
Seriously, I've heard people talking about how our monies are deducted, but when it comes to the SGMC program, I really argue with them on it because I know how helpful that project has been to myself and my family. Had it not been for that project, I'm not sure we would have been able to really go on with the treatment, the chemotherapy treatment. But because of this one, seriously, I'm always grateful and I'm always thankful for NAT for this connection they have with the Sweden Ghana Medical Center. Seriously, I really appreciate it so much.
As a teacher, how are you preparing for your retirement? And how are you investing for your future benefit? Do you know that when you join the Teachers Fund of NAT, with a minimum monthly contribution of 50 Ghana cedis, you could secure a great retirement package for yourself? The Teachers Fund, as a retirement supplement scheme for members of NAT, offers you the opportunity to plan for a fulfilling life after active service. For more details, visit any NAT district office. Tomorrow.
It can be prostate, cervical, breast, endometrial, head and neck, colorectal, or any other cancer. They have no place here. Why? Because SGMC Cancer Center treats all solid tumors no matter the stage of the disease. We use advanced technology like radiotherapy, brachytherapy, and chemotherapy for our treatment. Locate us behind Lakeside Estate, Community 8, Katamanso, or call us today on 0201 409 403 or 0262 253-328 for inquiries and booking, and your cancer burden will be a thing of the past. NAT, Narrate, ECG staff, as well as their spouses and children below 18 years do not have to pay to receive treatment at SGMC. SGMC Cancer Center, taking away the burden of cancer.
Like and follow us on Facebook, Ghana National Association of Teachers-NAT. Follow us on Instagram, Nats_HQ. Subscribe and watch our videos on YouTube, Ghana Teachers TV. Follow us on X, Twitter at Nats Official. Read more about Nats on www.ghanateachers.com or email us through info@ghanateachers.com.
She was treated all right, And before she got treatment, she said, oh, she signed a consent form that we can do a follow-up to interview to see how she's recovering, the benefit. After the treatment, the team came, but then I was in Bronga Hafo. And when we got to her, call her, she said she was not ready to speak before the cameras. I said, oh, but you signed a form. And she said she needed a treatment. So it means she did it under duress. And in law, anything that you do under pressure, it says it's not valid. Because I needed the treatment, I signed the form. So the point we're making is, NAT is a responsible union. We respect your rights. We are here engaging you to let you know that the monies you pay for, we use it to treat ourselves. The cost of treatment is quite expensive. The minimum ranges from 50,000 to over 500,000. An individual cannot sponsor him or herself. So as a union, we do this. But most of the times, our members are not willing to come out to talk about it. So we are here to educate you about the cancer fund, that it exists. Your money that you contribute goes to help somebody somewhere. If you don't know much about it, this is an opportunity for you to ask questions.
I've been a NAT member, but I wasn't so involved in finding out what exactly is the activities of NAT or what it stands for. But after, or upon second thought, I started reading about NAT. I then found out that they purchased the SGMC facility from the Swiss government. And I then realized how useful the association is. So I will urge every teacher, most teachers, to at least join NAT for that policy alone. If they can change the name from NAT Cancer Fund to, let me say, Oniado Cancer Fund, I think it will even explain a lot. Because most people don't even understand the NAT Cancer Fund. They will then come to you and say, but I think with the NAT Hour and what TV32 you are doing, you have to commend you for what you are doing. It will pave way for others to know that indeed NAT is doing a lot. NAT is really doing a lot for the teachers nationwide. So I will urge every teacher to join NAT so that in case of you are diagnosed of cancer, which nobody would like to wish for an enemy, talk alone of a loved one. But who knows what the future holds. For future, let me say, calamities, you have to plan and join NAT so that in case you are diagnosed of the cancer, you know that you have at least a solid rock to lean on, which is the NAT Cancer Fund and the SGMC facility that NAT have been able to purchase.
ECG bring their people there, they pay. But for NAT members, it is free. The only thing you need to produce is your pay slip, confirming that you are a NAT member. Under that case, you don't pay a penny. I repeat, you don't pay a penny. The only cost you incur is the diagnosis, because you would have gone to a facility for them to determine, do the lab test. The biopsy test costs not less than 3,000. Those who do biopsy, they cost not less than 3,000 Ghana cedi. So you need to do that test. That one you will bear the cost. An independent lab will confirm that actually you are suffering from cancer of this. Then you take the results there with only your pay slip. It's free. It is free because you and I, we are going to pay for the one benefiting from it. So it is a family thing that we decided to take care of one.
I would say NAT is doing very well for the teachers. So we encourage them to do more for teachers, and also are able to encourage some teachers who are not NAT members to join NAT in the system. I convinced one of the NAT Cancer Fund, and the other two, I convinced him about the insurance that NAT is offering for 8 members. One has joined already, and one he's on process. So they took his staff ID and that they will do the process for him.
I will use this opportunity to tell other colleagues who are not in the association that they should come on board, because this is a good initiative from NAT. I've never heard it from any of the associations, but NAT is doing it, and it's a good thing. So we must all support. Our colleagues shouldn't think they've been deducting our money for nothing. They are really using it for something that will help us. Whenever they bring something on board about maybe the association deducting their monies and other stuff, no, I really go straight at them. I tell them that I'm a living testimony, especially with this SGMC program.
As a teacher, how are you preparing?
It can be prostate, cervical, breast, endometrial, head and neck, colorectal, or any other cancer. They have no place here. Why? Because SGMC Cancer Center treats all solid tumors no matter the stage of the disease. We use advanced technology like radiotherapy, brachytherapy, and chemotherapy for our treatment. Locate us behind Lakeside Estate, Community 8, Katamanso, or call us today on 0201 409 403 or 0262 253-328 for inquiries and booking, and your cancer burden will be a thing of the past. NAT, Narrate, ECG staff, as well as their spouses and children below 18 years do not have to pay to receive treatment at SGMC. SGMC Cancer Center, taking away the burden of cancer.
Like and follow us on Facebook, Ghana National Association of Teachers-NAT. Follow us on Instagram, Nat_HQ. Subscribe and watch our videos on YouTube, Ghana Teachers TV. Follow us on X, Twitter at Nat Official. Read more about NAT on www.ghanateachers.com or email us through info@ghanateachers.com.
And the radiotherapy has to do with the use of radiation. They will concentrate the radiation, high radiation, on the cancer cells. It will burn and it will affect normal cells. But the good thing is that when cancer cells are destroyed, they don't have the ability to regrow. But normal cells can regrow. Okay, so it will burn part of the normal cells and the cancer cells. The cancer cells are excreted from the body, but it takes a process, and then the normal cells will regrow. The burn out or the worn out ones will wear out and regrowth will come. So it is a process that is demanding, and sometimes when you are not that even strong physically, it has an impact on your recovery. But it is something that we pray we do not get there. The last time somebody came was going to the place, I gave the center number to the lady, and the question she asked me was, are you sure they will pick? And I said, please stand here and call. I getting it? And I said, why do we, I don't know what your experience has been,